Welcome to this video. The reason why I started this series is to make anatomy easy and interesting. As we all know, in our med school, understanding anatomy was a huge task. Yes, it was really a huge task. It is because in anatomy we had to remember, or rather memorize, a lot of stuffs. But the truth is, anatomy can be learnt or understood easily and effectively. Do you want to know how? By a simple method called clinical integration and correlation. So basically what I am going to do is to integrate anatomy with a live clinical scenario and make you realize the true importance of anatomy in medical and surgical aspects of a disease and its treatment. So come on, let's not waste any more time and get into our first case for today, which is right before you. So the first case for today is a 32-year-old woman delivered a large 400 and 800 gram, which is 4.8 kgs, baby vaginally after a somewhat difficult labor. Her prenatal course was complicated by diabetes. So obviously we all know that in case of GDM or over diabetes, there is a high risk of a macrosomic baby. So here, as you can see, the 4.8 kg baby is obviously a macrosomic baby. So in case of a macrosomic baby which developed during pregnancy, at delivery the infant's head emerged, but the shoulders were stuck behind the maternal symphysis pubis. So as you can see in this diagram, the head has been delivered, but the shoulder is stuck behind the symphysis pubis of the maternal pelvis. So in this case, obstetrician tried to execute maneuvers to release the infant's shoulder. So we will talk about this maneuvers later in this video to release the infant's shoulder and complete the delivery. The infant was noted to have a good cry and pink color. So this denotes that his Apgar score was good. Okay, but was not moving its right arm. So we got a baby which was alive and healthy, but except for the fact that it had this paralysis. So today's case is nothing but we are going to discuss about brachial plexus. So what is the most likely diagnosis in this case? In this case, it is a case of shoulder dystocia. So final year students and interns would obviously know about it. Even the pre-final years maybe have heard about it. So it is a case of shoulder dystocia. What is shoulder dystocia? As the name indicates, it is a difficult labor which caused the shoulder to stuck behind the maternal pelvis. So what is the reason for it? It is because a big baby cannot come out of a normal sized birth canal. So what is the etiology for this condition? Obviously it is due to a GDM or a diabetes leading to a macrosomic baby. And what is the reason for this paralysis? So this is where anatomy comes into play. So it is a case of Erb's palsy. As you all know, it is a case of Erb's palsy. It is caused due to the stretching of upper brachial plexus during delivery. So as you can see, since the size of the birth canal is not sufficient, the doctor tries to stretch out the head from the shoulder in order to deliver the baby. This causes the angle between the shoulder and the head to increase. This angle, it increases. So as it increases, as you all know, the brachial plexus is located in the neck region, just like this, as you can see here in this image. So when the head stretches from the shoulder, this point is under stress and it gets injured. This is the cause with this causes Erb's palsy. Okay, so let's now see what happens here. So obviously due to stretching of the upper brachial plexus during delivery, it caused Erb's palsy due to damage to the root C5 C6. Okay, so what is the maneuver which doctors do in order to prevent shoulder dystocia? It is Meck-Roberts maneuver. Okay, so as you can see in this diagram, this is Meck-Roberts maneuver. It consists of two parts. First thing, the doctor tries to flex the hip of the maternal thigh over the maternal abdomen, just like this. One second, just like this. They flex the hip over the maternal abdomen, and the second thing, they will try to push the baby outside the birth canal. So this is called as Meck-Roberts maneuver. What does this flexing of the hip does? It generally increases the size of the birth canal, so helping the baby to come out. So sometimes it may work and can deliver a normal baby, or sometimes it may not work and it can lead to Erb's palsy. So in order to understand about Erb's palsy, you may have to know the anatomy of brachial plexus and the muscles it supplies and its actions. So please do check out the second part of this video to know and master the topic of brachial plexus. Thank you for watching. Please make sure you subscribe, share and comment below this video. Thank you.